class for ophthalmology for undergraduates. Today I am going to talk about astigmatism. What is astigmatism? Before going to that, we should know what are the refractory errors. One is hypermetropia, second is myopia, third one is astigmatism. Hypermetropia, all of us know, it is called as long-sightedness. In hypermetropia, the light rays coming from a distance, they get focused behind the eyeball. So that is hypermetropia. In myopia, the light rays coming from a distance, they get focused within the eyeball, that is well in front of the retina of the eyeball. So that is myopia, otherwise called as short-sightedness. Now coming to astigmatism, here there is a difference between those two conditions and this one. In myopia and hypermetropia, the light rays, they get focused at one point. They get focused at one point. But in astigmatism, the light rays coming from a distance, they do not get focused at one point. They get focused as a focal line. You can see here the light rays, and some rays are getting focused at this point and some rays are focused here. So they form a focal line. So that is the problem with astigmatism. What is the definition for astigmatism? Astigmatism is a refractive condition of the eye in which parallel rays of light coming from the distance do not come to a focal point. They instead form a focal line. We should know why astigmatism occurs. Astigmatism is due to variations in the curvature of the cornea or the lens. So that is causing this astigmatism. You can see here, this is the cornea of the eye, that is the black of the eye. The cornea should have equal curvature in this meridian and also this meridian and in all meridians. Then only the light rays will get focused at one point. Similarly, the lens inside the eye should also have a equal curvature vertically, horizontally and in all meridians. Then only the light rays going into the eye will get focused at one point. Suppose the vertical curvature is more, it is more curved and horizontal curvature is less curved. Then what will happen? The vertical rays will get focused in front of the retina. The horizontal rays will get focused behind that vertical rays. So that is called as astigmatism. So astigmatism is a problem caused by this cornea and the lens inside because of their change in the curvature in different meridians. Now let us see how astigmatism is classified. Astigmatism is classified as regular astigmatism, irregular astigmatism. What is the difference between regular astigmatism and irregular astigmatism? In regular astigmatism, I said the meridians are there in the curvature. One meridian and another meridian which are having a different curvature will have an angle of 90 degrees between them. They will be at a right angle. In irregular astigmatism, what will happen is one meridian which is having a curvature will be different from another meridian which is having a different curvature, but these two meridians will not have a distance of 90 degrees between them. There may be a variation. See here it is wide, this is 60 degrees. Here it is not wide, this is 30 degrees. So a difference will be there in the curvature. Regular astigmatism is caused by change in the shape of the cornea or lens, but irregular astigmatism is caused by diseases of the cornea. You have a corneal ulcer, the surface of the cornea becomes very much irregular, like a broken road, like that. So that will cause irregular astigmatism. This irregular astigmatism will be causing so much of problem to the patient, and it is very, very difficult to give a very good vision for this patient by any type of treatment. So that is irregular astigmatism. I am not going to discuss further about this. Coming to the regular astigmatism, we have two types of regular astigmatism. One is a with the rule astigmatism, another is the against the rule astigmatism. Normally, our cornea, the vertical curvature, the vertical meridian is little bit more curved than the horizontal curvature. So this is normal thing that is present in our eye. Now coming to the with the rule astigmatism, here too the vertical meridian is more curved than the horizontal meridian, but it is beyond the normal limits. That is why it is causing this refractory error. There is a small limit in the difference in the curvature of the two meridians normally, but when there is a very big difference between these two curvatures, even though they respect the vertical meridian is more curved than the horizontal meridian, it will cause refractory errors. Coming to the against the rule astigmatism, that is, it is opposite to the nature. It is opposite to the natural thing that is present in the eye. In against the rule astigmatism, the horizontal curvature is more curved and vertical curvature is less curved. So that is against the rule astigmatism. Coming to the other types, other classification of astigmatism, we classify astigmatism into simple astigmatism, compound astigmatism and mixed astigmatism. What is simple astigmatism? Simple astigmatism is nothing but we have a lot of light rays coming into the eye. The light rays coming in one meridian, they get focused in the retina. The light rays coming in the opposite meridian, they get either focused in front of the retina or behind the retina. So, when one group of rays are getting focused on the retina, other group does not get focused on the retina. That is called as simple astigmatism. So this astigmatism where the light rays are focusing in front of the retina is called as simple myopic astigmatism. If it focuses behind here, that will be called as simple hypermetropic astigmatism. Coming to the compound astigmatism, here both the rays, both the meridians do not get focused on the retina, but they are friendly. That is, both the vertical and horizontal meridians, they either go behind the retina or they both of them come in front of the retina. So here I have drawn both the things focusing behind the retina. So this is called as compound hypermetropic astigmatism. If they both focus in front of the retina, that will be called as compound myopic astigmatism. Coming to the mixed astigmatism. Here, both the rays, both the meridians are not friendly. They do not go with each other. One meridian gets focused behind the retina, another meridian gets focused in front of the retina. So, one is hypermetropic, another is myopic. So, this is called as mixed astigmatism. We have both hypermetropia and myopia. Astigmatism can also be classified as oblique astigmatism and bioblique astigmatism. In oblique astigmatism, the meridians will not be at 90 or 180 degrees. They will be at some other degrees. But the two opposite meridians will have an angle of 90 degrees. They will be at right angles. So here you can see that this meridian is this way and this meridian is this way. So this is approximately 30 degrees. So from 30 degrees you add this will be at 110 degrees. So that way it will be there, and the meridians will respect the 90 degree angle between them. In bi-oblique astigmatism, the meridians, they neither obey 90 degrees and 180 degrees, or they don't respect each other. They do not form an angle of 90 degrees between themselves. Here you can see that the two meridians are like this, oblique, and the distance at one point is 165 degree angle, the other point is 15 degree angle. So this is called as bi-oblique astigmatism. Another important thing every student should know is the STRUM'S conoid. So this is for regular astigmatism. Here I have drawn a cornea or lens, whatever it may be. This is the round I have drawn here, oval thing. Here the vertical meridian I have drawn in blue color, horizontal meridian I have drawn in green color. The light rays are coming from outside, and the two meridians are at 90 degrees. That is, vertical meridian is at 90 degrees, horizontal degree is at 180 degrees meridian. So these two meridians are going to focus these light rays. The vertical meridian, which is having a less curvature here, focuses the light rays at this point. The horizontal meridian, which is more curved, because of the reduced focal length, they focus the light rays much in front of the vertical meridian. So this is what I have drawn here. It's a very, very simple diagram. You can just practice and draw it. How we are going to classify astigmatism based on this STRUM'S conoid. So I have drawn 5 dots or lines here. So if the retina is at this position, if the retina is at this position, you can see both the light rays are getting focused behind this retina, assumed retina. So this is called as compound hypermetropic astigmatism. Suppose the retina is in this position, what will happen? One group of rays are focusing on the retina, another group is going behind. So this is called as simple hypermetropic astigmatism. Simple hypermetropic astigmatism. Here what happens is the focal line will be vertical. If the retina is at this position, that is between the two focal points, then what will happen is one group of rays are myopic, another group of rays are hypermetropic. So this is called as mixed astigmatism. Mixed astigmatism. Suppose the retina is here, then this group of rays are focusing on the retina, this group is focusing in front of the retina. So this is called as simple myopic astigmatism, because only one group is at fault. Here the focal line will be horizontal. Suppose the retina is at this position, then both the rays have already come to a focus. So this becomes myopia, but this is a compound myopic astigmatism. Compound myopic astigmatism. This is how we draw the STRUM'S conoid and tell what are the different types of astigmatism under regular category. Here the patient will be having better vision if they have a mixed astigmatism. Mixed astigmatism, they will be having a better vision. If they have a simple hypermetropic astigmatism or simple myopic astigmatism which is of a very large degree, the objects may appear either horizontally elongated or vertically tall. So depending upon this lines, you can have a distortion of the objects. If the problem is going to be like this, compound myopic or compound hypermetropic, the vision will be very much blurred for the patient. What are all the problems a patient with astigmatism will come to the hospital with? They will be saying that easily they get tired in their eyes, that is called as asthenopia. They are not able to continuously do their work or write or read or see mobile phones. They get easily tired. Eyes become tired. The second thing, they will have a frontal headache because of too much of effort they have to put into make things clear. The third thing is the patient, because of this astigmatism, may develop a neck pain and giddiness. The fourth and most important thing is the patient may have a blurred vision, things may not be clear if there is a compound myopic or compound hypermetropic astigmatism. There will be a distorted vision whenever the patient is having a simple hypermetropic or simple myopic astigmatism. Sometimes these patients with the astigmatism will say that the letters are clubbed together. So you see one letter very close to each other, they will be running together. They will not be separated. They will not be seen as a gap between the letters. So that is called as running together of letters. Apart from that, you can see these patients having the eyelids partially closed. That is slit-like eyelids. So they will keep their eyes closed and they will have a small opening of the eyes and they will be seeing things. By doing so, what they are doing is they are cutting away one meridian of light rays and they are using only another meridian to see the vision clearly. So that is slit eyelids. The eyelids are partially closed. So that problem they will be having. Coming to the treatment for astigmatism. Astigmatism can be very well treated with spectacles in case of regular astigmatism. We give cylindrical lenses which will have different curvature to match the altered curvature in the eye of the patient. Contact lens. You have two types of contact lens. One is a soft contact lens and rigid contact lens. Soft contact lenses with the cylindrical power can be used in regular astigmatisms. Rigid contact lenses can be used in irregular astigmatisms where there is an irregular surface of the cornea. LASIK, laser in situ keratomileusis. So this is a procedure to avoid spectacles after you achieve stability of vision whenever you are wearing a spectacle. This is very useful and very good effect in regular astigmatism. Phototherapeutic catectomy can be done in irregular astigmatism. So this is the treatment method for astigmatism.